Probiotics in the form of cow's milk and fermented foods like yogurt have been a part of the human diet for ages. My ancestors believed that they were essential for a long life. My partner, Lily, and I, Hanieh, are students of dental hygiene at Lake Washington Institute of Technology, and we were curious about how the efficacies of oral probiotics and tongue cleaning compare in the treatment of oral malodor. Oral malodor, also known as halitosis, or more simply as bad breath, is a condition where an unpleasant odor is projected from the oral cavity. This odor not only offends others, but also causes social and psychological distress for those suffering from it. Malodor is mainly due to specific gram-negative bacteria breaking down substrates in saliva, blood, and food debris in the mouth. This breakdown produces volatile sulfur compounds, which are characteristics of halitosis. The dorsum of the tongue has been implicated in the production of malodorous volatile sulfur compounds. Its vast surface area and papillary structures house a large quantity of widely spread microorganisms, allowing for plenty of access to nutrients from saliva. Mechanical techniques such as brushing and scraping are commonly advised to clean off the bacterial biofilm from the surface of the tongue. However, a newer approach is to introduce living microorganisms via oral probiotics to inhibit or replace the volatile sulfur compound producing microorganisms that are already occupying the surface of the tongue. We conducted a literature review looking for evidence of their efficacy. Our PICO question was, for a patient with halitosis, will oral probiotics, compared to brushing or scraping the tongue, be more effective in reducing the bacteria causing the malodor?
To address our PICO question, we started our research on LWIT's Library Learning Commons Advanced Search and PubMed Advanced Search. To locate suitable publications, we use keywords and relevant mesh terms, the most fruitful of which were oral malodor, halitosis prevention and control, toothbrushing, microflora, probiotics, oral hygiene, sulfur compounds, tongue, volatile organic compounds, breath tests, and microbiota. Using Boolean operators and not, we narrowed our search to the dental field and excluded articles that focused on general probiotics and their overall health effects. We restricted our search field to only display citations with free full text available and checked that articles came from peer-reviewed journals. At times, we employed additional filters to limit the results to evidence pertaining to humans, available in English, and published over the last decade. Over 50 scholarly journal articles were appraised, and 2 concept maps were generated using Coggle. The concept maps were then compared, and the journal articles were filtered a second time to focus on the most significant papers. Finally, a literature review outline was created to compile the evidence we had gathered.
One clinical trial found that after a week of toothbrushing alone, there was not much of a decrease in the participants' oral malodor. But when tongue brushing was added to the oral hygiene routine using a small toothbrush, there was a significant reduction in volatile sulfur compounds within a week, dropping the prevalence of malodor by 87.4%. In a crossover trial, researchers compared the effectiveness of using a toothbrush versus a tongue scraper in improving oral malodor and reducing tongue microbiota, and found no statistically significant difference. In a randomized control trial, researchers showed that a systematic pattern of brushing the tongue was more effective in reducing malodor than unsystematized mechanical tongue cleaning. They named this systematic pattern the X technique, and it involves 3 basic movements, essentially drawing an X and then a line down the middle of the tongue, each time moving from a posterior to anterior direction. An organoleptic scope an organoleptic score is a measurement of the degree of malodor as ranked by an examiner. They found repeating this pattern 3 times was significantly effective in reducing organoleptic scores, although 6 times was ideal to reduce total tongue surface bacteria.
Assessing the efficacy of probiotics in the treatment of halitosis, many studies have tested specific strains of bacteria to measure their effects on inhibiting volatile sulfur compound, or VSC, producing bacteria already present in the oral cavity, especially against Fusobacterium nucleatum and Porphyromonas gingivalis. These 2 species have been recognized as major contributors to oral malodor and are found universally in human oral microbiota. In a double-blind, placebo-controlled, randomized crossover trial, Lactobacillus salivarius in the form of a tablet was found to significantly reduce VSCs, the number of F nucleatum, and total tongue coating bacteria when compared to a placebo tablet, even though organoleptic scores decreased similarly for both groups, which could be due to the placebo effect. Kiwi fruit powder that contains cysteine protease, or actinidin, is often marketed as a natural probiotic or probiotic supplement in tablet form. It has also been found to reduce VSCs, the concentration of F nucleatum and total tongue coating bacteria, when directly compared to tongue brushing. Even though this study was not testing living microorganisms, this was the only study found that directly compared a probiotic tablet against tongue brushing. In a different study, Wisella sebaria, a lactic acid bacterium, and several others were treated for up to 90 minutes with lysozyme solution and up to 9 hours of hydrogen peroxide. W. sebaria was found to survive in poor conditions, reminiscent of the mouth. It was found to not only have antibacterial qualities, but also to inhibit VSC production of F nucleatum and P. gingivalis by 97% and 93.9%, respectively. Researchers who employed Streptococcus salivarius K12 against oral malodor found a substantial reduction in 85% of the treatment group versus 30% of the placebo group after only 1 week of use. But they also found that optimal dosing was different from person to person. And even though traces of the probiotic were found in the saliva of all treated subjects after 14 days, persistent administration of the probiotic might be necessary to maintain low levels of VSCs.
Our analysis showed that oral malodor is mainly due to volatile sulfur compounds in the breath and are produced by a variety of microorganisms, most notably by F. nucleatum and P. gingivalis, residing on the dorsum of the tongue. Current treatments of halitosis focus on reducing the concentration of volatile sulfur compounds by vacating the microorganisms from the tongue or inhibiting and potentially replacing them with the help of other microorganisms by administering probiotics. The evidence suggests that both methods of mechanical cleansing and introduction of certain strains of probiotics have significant impacts on reducing volatile sulfur compounds in the breath and can be equally suitable at treating halitosis. While numerous in vivo and in vitro studies have demonstrated the benefits of various strains of bacteria to this effect, identification of the best suited probiotic to treat halitosis requires more research. Additionally, the optimum dosage of any probiotic has been shown to differ from person to person, and establishing this dosage requires further study. Furthermore, we were unable to find evidence that directly compared the efficacy of tongue brushing against that of a microorganism containing probiotic in a clinical trial. More research is needed to offer this evidence.
Now we have a couple of questions for you to think about. As a patient, if you had halitosis, would you prefer the mechanical method or a probiotic tablet? And as a clinician, if your patient had halitosis and was having difficulty implementing this mechanical method, based on our findings, would you recommend an oral probiotic? And these are our references. Thank you for listening.